One of the biggest issues with atrial fibrillation is the risk of stroke. Patients with atrial fibrillation are at an elevated risk of having a stroke because blood can clot in the heart and then go to the brain and block blood supply. Unfortunately, a stroke with atrial fibrillation can be a devastating complication. Because of that, we recommend that patients with atrial fibrillation stay on blood thinners. But unfortunately, some patients have trouble with these blood thinners. They can have excess bleeding, and some patients have a higher risk of bleeding in the brain or bleeding in the gut. For that, we have an alternate strategy called the Watchman device. 92% of the clots that form in patients with atrial fibrillation form in the left atrial appendage, which is a little outpouching on the upper left side of the upper left chamber of the heart. This is actually amenable to closure with a plug device called the Watchman. The Watchman procedure is done under general anesthesia and is a fairly complex procedure involving a number of physicians in the room at the same time. But essentially, we image the left atrial appendage through an ultrasound probe put through the food pipe, while from the right groin, we snake up a long tube to the left upper chamber and deliver this Watchman device to block the left atrial appendage. Once this is delivered, we still continue blood thinners for some weeks more to make sure that the blood does not clot on that while the body incorporates this Watchman device by growing its own endothelium or surface lining of the heart over it. Once that is done, we can then start to reduce the level of blood thinners, and generally most patients by 6 months can be off all blood thinners except a baby aspirin a day. It's been shown that the Watchman device can reduce the risk of strokes just as well as the powerful blood thinning medicines can. There's nothing wrong with taking a powerful blood thinning medicine, and many people can tolerate that medicine well. But if you cannot tolerate that medicine, then the Watchman device is a useful alternative and is likely to be better tolerated by you.